A regular doorbell is of little use in a deaf person's home.
I have been known to sleep through it, so someone has been at the door and pushed it, and I have slept through it.
For Christine Yerbury, who lives alone, a fall detector that works by making a phone call is similarly useless. But getting her hands on a text-based alternative has been challenging. She's been waiting for an assessment with an occupational therapist since October last year, but has been told there are no Canberra-based providers who sign. In the meantime, she's had several falls.
I have the steps outside the apartment here, and I've fallen several times.
She's not alone in her fears about getting older in a hearing world. A group of other deaf seniors regularly meet around Canberra.
We struggle with all sorts of, getting support workers, getting information in Auslan. And it's not just having things interpreted.
71-year-old Anne Madden is worried about her future. Her husband is also deaf and has been diagnosed with dementia.
I need to follow him around. Sometimes he forgets to turn taps off, leaves the shower running. And plus he can't hear that the water's still running, or he'll leave the fans running because he can't hear that they're still on.
Earlier this year, she discovered that moving her husband to a nursing home in Canberra isn't an option.
The people who worked there had no experience with deaf people and signing deaf people, and that really concerned me. I couldn't imagine me putting my husband into a facility like that. It would increase his isolation many-fold.
Australia's largest Auslan service provider, Deaf Connect, agrees deaf Canberrans are under-supported. And 2 years ago, an ACT legislative inquiry into Auslan services made 25 recommendations to the government to address a lack in Auslan care. But members of the deaf community are concerned progress has stalled.
Unfortunately, there hasn't been a lot of action in responding to those recommendations.
We need aged care workers who go in and learn as part of their training to communicate effectively with deaf people. And ideally, it would be wonderful if we actually employed deaf people who have aged care qualifications to work in these facilities.
A community that doesn't want to be left behind. Emily Anderson, ABC News, Canberra.